The American Rehabilitation Educational Network presents Clinical Update, dedicated to meeting the continuing education needs of rehabilitation and healthcare professionals. Clinical Update is a growing series of informative, useful videotape excerpts from Aaron's monthly video conferences. Applying the talents and expertise of distinguished faculty members from around the world, these programs are specifically designed to provide concise, clinically accurate knowledge for use within the daily practice of physical therapists, occupational therapists, nurses, psychologists, speech pathologists, physicians, and other healthcare professionals. This program, Clinical Management of Lower Extremity Function with a High-Tone Ambulatory Patient, features Jan Utley working with the patient. Isabel Bowman provides additional commentary.
Let's turn now to clinical management, starting with some key concepts. Bo, why don't you start for us?
Well, when we start talking about preparing the patient for walking, we need to think about preparation, what is involved in preparation. And most of the time, we usually start the patient in a sitting posture to work on making sure that they have good mobility in the trunk. And as soon as they have the mobility, and sometimes we do some stretching to get that range, then we'll have them start working with us so that they learn to control the movements of the trunk as we go through various activities in sitting. And you'll see Jan taking Don through some of these activities. But to list them, a few of them, one is scooting the hips forward on the mat and then scooting back sometimes. And while we do that, we work on getting a better trunk control, more erect posture in the trunk, and using the muscles to do the lateral shift and scoot the pelvis forward. Then we have the patient come to standing. And in the preparation for that activity, you have the patient with a nice dynamic trunk and then bending forward, maintaining that dynamic trunk, which helps to activate the legs so that they are used more effectively in the push-up to stand. And so all of those activities are a part of preparing the patient for standing and ultimately walking. In those activities, we try to maintain good body alignment, shoulders over the hips, symmetry in the trunk. Unless you're moving to one side and then scooting the pelvis, then you go out of symmetry, but then back to symmetry. And also a good tone quality, so that you want the patient to have enough stability in the trunk and good tone in order to maintain stability, but they also need to be able to move, so that you're looking at the ability to be stable but have movement with that stability. And one of the ways that we use to help the patient with stability oftentimes is to incorporate the arms into weight bearing as we do these activities, either with weight bearing on their legs or on the side of the mat or in a position where they can use their arms to help provide a more stable trunk. And it also helps to control the tone in the limbs and prepares the limbs for more advanced functioning as well.
Okay, then, with that as background, let's talk about working on stance. You've given us some direction in the workbook on page 7, and we're going to be taking a look at that sequence on tape. But first, what are the major principles you want us to keep in mind as we watch?
The most critical thing is to keep the shoulders aligned over the pelvis, and that both of those are aligned over the weight-bearing surface. Since you're walking, you're shifting from one foot to the other. But the movement of the trunk stays as a unit over each leg alternately. And when you'll notice, when we go through the sequence, you notice that I have the subject in a weight-bearing position on the involved side, which is her right side. Now, that's an important aspect because that weight-bearing does help her, encourages her to shift to that side, which is the involved side, and they don't often want to do that. So, plus it also gives stability to that side. But in order to get that stability, you have to have the appropriate alignment of the arm. And it might be well if I just sort of went through that alignment to make sure that everybody understood the posture. Because it's an important pattern. What you're trying to do is to get the arm in a weight-bearing position, and I'll use my leg here to do that. First of all, if you think starting at the proximal end, you want the shoulder girdle to be in a slightly protracted position. Mm-hmm. And then you want the shoulder joint to be in slight lateral rotation so that the bend in the elbow is facing mm-hmm. forward. You want the elbow to be slightly ahead of the shoulder. It could be out to the side, but you definitely want to have it ahead of the shoulder as well. Mm-hmm. Then since you're weight bearing on the hand, you want to have some bend in the elbow, but not too much. You have a range that you can use for getting support on the arm but the hand needs to always be below the elbow. And it's important not to have a fully extended arm. Yeah. Yeah. Then obviously, in order to weight bear on the hand, the forearm is in a pronated position. And then the wrist is in neutral as far as radial and ulnar deviation is concerned, but you usually have a little bit of extension at the wrist as well. And then the hand position, if you put your hand on a flat surface, what you see is a spread of the metacarpals with radial abduction of the thumb. And then the fingers are lightly placed and relaxed as they go into weight bearing. It's not a real flat hand. Mm-hmm. The index and middle finger tend to be a little bit more flexed than the ring and little finger. And you want a hand that you're getting most of your weight bearing along the first metacarpal, the fifth metacarpal, the heel of the hand, and then the tips of the fingers.
Okay.
And you have some along the heads of the fourth and fifth metacarpals.
Okay.
So that's an important position, and we try to maintain that with the patients. That's the most easy position to get and get a support. Then you can go to other parts of in relationship to the body, but the easiest place to get it is out in front.
Okay.
Now the sequence that's listed in the workbook is a suggested sequence. You don't necessarily have to do all of those steps.
In the stance sequence?
That's right.
Okay. Well, we can better appreciate all that goes into this process as we look at a videotape of Bo demonstrating the stance sequence with Pam. Pam is a staff physical therapist at the Harmerville Rehabilitation Center, and we have seen her earlier in the tape segment on normal gait.
Once you have the individual in standing, it's very important to establish a good dynamic trunk, which means you have to have a slightly narrower base than Pam has. And then you need to get the trunk facilitated so that she is very dynamic and is in midline. If the shoulders are back, one shoulder is back, or the hip is back, then that's important to get that into a straighter position. Then the next thing you might do would be to just have her bend her knees slightly, staying in midline, and then coming back up, which helps her work on maintaining a good trunk posture while she moves the limbs. And it's much easier done in the midline. Once more. And that's fine, not too far, and then back up. Being sure that when she comes back up that she doesn't hyperextend her knees, so that you need to keep the trunk dynamic. Then you might want to have her shift a little bit to the involved side and bend both knees. So there's a little more weight on the involved side, which will help her gain and straighten a little more control of her knee. Many patients have instability in the end range of extension. And by keeping them a little bit more on the right, which in this situation is the involved side, and then having her bend a little and then coming back up, staying on the right, will really make her get much better control of her knee. At the same time, you're always maintaining good alignment of the shoulders, making sure that the arm is in a good reflex inhibiting pattern with the elbow ahead of the shoulder and the arm in slight lateral rotation. Progressing from bilateral knee flexion, you can work on weight shift and have them stay dynamic in the trunk so that she stays stable in her hip, and then she might move her better heel out a little, and then the toe, and then bring it back in. All that really makes her stay in weight bearing on her involved side to help develop control of that hip. And usually you must facilitate the stability there as she does that. Occasionally the patient will do better if you have them weight shift laterally, be tall, and then take a small step forward. And again, you need to maintain stability, not allow them to shift their weight too far or drop the shoulders on that side. Then you have them work on midline control with the legs in a little bit of stride. And then you might have her shift back to the right, staying tall, and then step back with her left foot. Each time building stability on the weight-bearing side. I'm going to try that once more. Staying tall, weight shift to the right, and take a step. That's better. Now, having taken a step with her better leg, you're really working on gaining stability in the affected leg. And it's important for the patient also to be able to shift the weight forward and back in stride with the better leg forward, maintaining good alignment so that the pelvis is symmetrical, not one side further back than the other, as she shifts forward over one leg and then back over the other. And then she can get tall again and take a step back even with the other leg. That's right. From that, you may progress to having her step back with her better leg, getting tall, and then step back. That's right. Now she's in stride with the affected leg ahead. And it's important again to learn how to shift the weight forward and back, pushing with the legs. And as she does that, you make sure that they extend the leg as the weight bear and then shift back. Keeping the trunk dynamic, extend, shift forward. The heel will remain down because you have taken a fairly small step, and then she shifts back. And then I'm going to have her step back so that her legs are even. So I have her shift to the right again, get tall, and then make her feet even. Now, having done that, the patient is more ready to move into a swing sequence.
Okay, a couple of quick questions about what we saw. I noticed that on page 7 in the sequence for working on stance, point number 3 is reciprocal bending of knees with lateral weight shift. And that's something that we didn't see in the tape. And can you tell us why?
Oftentimes that is something that I don't always do it. I check to see whether the patient automatically does it as they shift their weight, but often that happens, and then I don't call their attention to that reciprocal bending because that can be a little bit confusing to the patient if you work on alternate bending like that.
Okay. And I noticed that you worked on half steps. At what point would you work toward a full stride?
Well, as the patient begins to get more sustained control in weight bearing with a small step, then you can start working in a slightly larger step. And it's really important to get a sustained control in weight bearing in order to have the patient prepared to go on into swing.
And that's how you can tell when the patient is ready to move on into swing,
right.
to graduate?
Yeah.
Okay. All right then, that's stance, and the next step, of course, is swing, because as the old song says, it don't mean a thing if you ain't got that swing. Talk about dating yourself, right? All right, let's go to videotape again and see how the swing sequence comes together as Jan this time works with Pam.
Now, to begin to work on swing, what you want to think about are the components at the beginning of swing. Basically, the pelvis stays even in the coronal plane. In other words, what most patients will do is begin to rotate back, like I'm rotating Pam's pelvis right now, at the beginning of swing on their involved leg. You have to prevent that and keep the pelvis even in the coronal plane. And basically, just get a slight shift forward without totally unweighting the involved leg. And as she shifts forward onto the left, not letting her overshift to the left, I just get a little release in her right knee, a very graded release. And if the patient can't do this, you can use your hand or your leg. And then I want her to keep her pelvis forward and her shoulders over her hips as she extends the knee from that position. So they learn to extend the knee with the pelvis forward and the shoulders aligned over the pelvis. This prevents the hyperextension at the knee in weight bearing. And then I can have her, if I want to go back into a little weight bearing on that leg, bring her back onto that leg a little more, and then make another weight transfer forward. As she weight transfers forward, get a little release with this leg, and this time a little more release, but not a lot. And what you can see when she goes into a little more flexion at the knee, the pelvis drops slightly on that side, which really allows for the release in the leg. The knee flexes slightly and comes in toward the other leg. This is difficult to see from the camera angle, but that's a very important component. Then I can have her extend again, keeping the hips forward, and put a little weight on that leg. Then I can have her shift forward again, get the release, and this time help her just a little bit get the feeling for the heel slightly coming off the surface as with this release, okay? And then she comes back onto it, keeping the pelvis forward, and holds. And she can shift forward again, get the release, pelvis drops as the knee flexes, the whole leg adducts in toward the other leg, the heel comes slightly off the surface. And here, I can have her just slide her foot up even with the other foot, not really bringing the foot off of the surface. That's another very important point. The patients perceive the leg as very heavy, and they feel that they have to pick their foot up off of the surface, and that promotes the elevation in the pelvis that you're trying to prevent. So sliding the foot at first really helps with this particular phase of gait. Now, once she's forward, I don't want to go into another swing phase until she steps again with the uninvolved leg. So I'll adjust the table just a little bit, and she can stay tall and use her abdominals a little bit. Good. And then we'll do a little bit of shift toward the right. She'll take a small step again with the left. And then from there, easy. It's also very important for the patient to keep the uninvolved leg extended at the knee when they start to swing the involved leg through. Many of them, when they release and get the flexion on the involved side, they also release on their uninvolved side, then making it much more difficult to bring the involved leg through. So I want to pay attention to what she's doing on her less involved side and get her to shift forward, get the release, and this time possibly with my foot, just to come under the lateral border of hers and let her just slide her foot up. And this time she could possibly slide a little more forward to go through. Heel in just a little. That's it. So that basically you can make a progression from a half step up even with the other leg to a full step through. Always weight bearing in between on the involved leg to prepare for a better non-weight bearing pattern of movement. Now, there are some options to help the patient get the idea about sliding the foot. You can use things under the foot to help promote this so that they just bring the knee through and let the foot slide instead of lifting the leg up by elevating the pelvis. One is a pillowcase. If you're on a surface like we're on here, now all I want you to do is step up even with your left foot. And you can put this under before the patient stands up. To save a little time, I'll just put it under Pam's foot here. And basically go through the same sequence to let her make a small step with her left leg. Shift her weight forward. Just get a release by letting the trunk elongate a little, let go a little more with your leg, and just slide the pillowcase through. And it's my job to make sure that she keeps the foot in a good alignment. The other option is to use, especially on carpeted surfaces, is to use something like a clipboard, which will slide more readily on a carpeted surface. And if the clip part of it is in the front, it helps the patient not slide off of it. Same sequence. Relax your arms a little bit. She's going to step forward, a small step with her left leg, and then basically get the release on the involved side and slide the board through. It's also very important to keep looking up at the shoulders and the head to make sure the alignment is right over the base. Now just step up even with your left leg. So that basically you're remembering that you always intersperse weight-bearing phases with swing phases on the involved side, and give the patient the idea of sliding the leg through or bringing the knee through instead of lifting the whole leg and foot. And to always observe what's happening on the uninvolved side at the same time and keep the body stable on the midline, symmetrical, with good alignment of the shoulders, over the hips, over the base of support. And that this release in the leg that happens at the beginning of swing is a graded release, allowing the hip to come down, the pelvis, the knee to flex slightly, the foot to go into a slight eversion, and the knee comes in toward the other leg slightly.
Okay, Jen, now this is a very controlled situation, and Pam is moving slowly through this sequence. How, this relates to a question that came earlier in the Q&A, just how can you work toward more speed and greater efficiency in gait?
I might mention first that the person in the tape was me, but with a different hairdo.
Not your twin sister. Right.
There are several activities that we work on to kind of achieve better balance reactions and increase the velocity of gait and the efficiency level in gait with patients. One activity is to work on stepping up on higher surfaces. And basically that's an activity which accomplishes several things. Number one, when you step up with one leg onto a higher surface, it prepares the patient for doing things like going up on curbs or going upstairs, which are all a part of functional gait, as well as just walking on a straight plane. And it also is an activity which encourages holding in the hip and the leg and the trunk in a more stable way. What we usually use to do that is a wedged surface. We found that, and not a real big wedge, and it goes from being almost nothing to being a higher wedge, and we get the patient to step first just barely onto that, so that that's only maybe a ½ inch to 3/4 of an inch rise, and then gradually build that up. So it's very important to grade that activity. A wedge surface also keeps them from tending to transfer all of their weight immediately onto the uninvolved leg, which is on the higher surface.
Okay.
We also work a lot on turning as an activity in treatment to really teach the patient to pivot on the involved leg and step around with the uninvolved one. Most patients do just the reverse of that.
Yeah, so pivot on the involved leg.
So they really maintain weight bearing for a longer period of time, so that maintained weight bearing for longer periods promotes, in the long run, better balance reactions.
Okay.
We also work on balance reactions in standing, and probably the easiest way to show you those is to demonstrate them on Bo.
Okay.
And so I'll get Bo to stand up, and it doesn't matter if they can see me or not. They need to see Bo. If I can keep her up and not let her fall and do this effectively, we'll be all right. She's one of the most difficult subjects to do this to, so. Now, basically, let's say her left leg is her involved leg. Now, I have my leg around her just to help facilitate her to stabilize around the knee. But working on balance reactions really involves moving the person and displacing their weight over the involved leg and getting an automatic stepping response in the leg, okay? So that she automatically steps with her right leg. and I can bring her out of that. Those can be done to the front. They can be done to the side if I'm good enough to do that with Bo. It worked. And they can be done back, okay?
Mm-hmm.
Most of the time, we prefer to do these without the arms in weight bearing, because if the patient has the arms in weight bearing, they'll use the arms for protective responses rather than the legs. That tends to inhibit the response in the legs. So you really need to,
So
it's
do
with
it
a
just
higher
as
level
you do.
patient that you do this, and you also control and keep the arms kind of relaxed to the side, so they really use their lower trunk and legs to facilitate these responses. And those are really important, thank you, Bo, reactions to work on. She's used to me working on her in all the courses anyway, so.
Okay.
But those are really good.
Jan, let's talk now about a patient you treated. Do you want to give us a little bit of background about Don? We did see him on tape earlier, but we don't know a lot about him.
That's right. Don was a 56-year-old man who had his stroke in October of 1986. And at the time we saw him in August of this year, he was being seen as an outpatient at the rehab center. We wanted a patient who would present with the problems of this lack of integration between the two sides, problem with weight bearing on the involved side, and a patient who particularly had a lot of problems with the associated reactions, the abnormal movement patterns that we talked about. I also think it's really important with Don to mention that one of his greatest frustrations was with his aphasia, his inability to communicate and express himself through his language. He did a lot with his body language, but the verbal communication was a real frustration to him.
All right. Thanks, Jen. Then let's take a look at the first of two tapes we'll be seeing with Don.
Now, we started Don in standing, and we wanted to have you see him sit and how much weight he puts on his less involved side. Also, when he scoots, how he gets an associated reaction into extension in his right leg. So you know that he has some problems with those abnormal patterns. Okay, I guess we're ready to start, Don. I'm going to come around in front of you, and you can just stay right on the edge of the surface. Okay, come a little more forward on the surface. That's it. Good. That's fine. I'm going to place your feet just a little bit more where I want them as I begin to work with you.
As Don scooted back on the mat, he got an associated reaction in his right leg.
Bring your left one forward just a little. That's good. And as I try to bring the right knee in, I feel a lot of resistance to that movement. First thing I want to do is get a little bit of a feel for what your tone is like, okay? So I'm going to just keep my knee there, just to keep his knee in line with his hip. Now sit up a little bit straighter. Relax your left shoulder just a little, that's it. Use your low back a little more. A little arch in your low back. Straight, easy, good. You're doing fine. Don't work too hard.
She had him relax the left arm because he was tending to push with it.
And you just sit tall while I do that. As I move the right arm around, I don't feel a lot of resistance until I get to about this point in elevation at the shoulder. It's more of a heaviness, actually, than a resistance. I don't feel a lot of resistance at the elbow. Moves freely. At the wrist, I get some resistance to extension, but more resistance to extension in the fingers. The important thing here is to notice that it is fairly easy to get a release in his tone where he is stiff. The fingers release fairly readily with a constant pressure, and the wrist comes into some extension. The thumb moves with only slight resistance into extension. So I don't feel as much resistance in his thumb as I do in his fingers. That gives them an idea of what your tone is like, since they can't all feel you, all of these people.
To achieve the release in the hand, she radially abducted the thumb and extended the fingers and wrist.
Now I'm going to move your arm just a little more. I want you to straighten your back just a little. That's good. Good.
Maintaining a better trunk enables the tone in the limb to be better.
Just going to try to place his hand just a little bit in weight bearing while I look at his trunk. Now straighten your back a little bit. And then slump a little bit. And when you slump, I just want your hips to go back a little. Good. Stay there for a second. And come up straight.
Now she's looking at the separation between the upper and lower trunk and seeing whether he can move his pelvis underneath the shoulders into an anterior and posterior tilt.
Now a little straighter. Just straighten your back a little more. Arch. Okay, and then slump. Good. A little more. That's your big chance to rest, see, when you slump. You take advantage of that every chance you get, huh? Now come up straight again. And I feel some resistance in trying to move his trunk over to the left side, which at this point, after mobilizing him toward an anterior tilt a little bit, his tone is a little lower in the lower trunk on the right, and slump. He doesn't tend to hold himself on the midline dynamically by using his right side up tall. Now I'm going to feel your shoulder a little bit. You just stay cool on top, if it's possible to stay cool.
As she moves the trunk around the arm in weight bearing, that's going to help the arm tone become better and decrease the tone in his hand.
Now I'm just going to come around and move his shoulder girdle just a little bit into abduction, the scapula. And I don't feel a lot of resistance there. Some resistance, but not a lot. So he has some stiffness in the upper trunk, but not an extreme amount of stiffness. Get your head a little straighter. Now slump again. Just let your hips go back. That's it. Tends to move from the upper body and not move the lower body until I remind him. Up straight. So he needs a feeling for the sensation of movement in the lower trunk. Okay, now I'm going to go around the back a little bit and mobilize your lower trunk to try to release a little bit of that stiffness toward the left side. Now I'm just going to move you a little bit that direction. And then I'm going to let you only come back to the midline. Okay? A little bit to the left, and then right to there. Okay? A little left. Okay. Let me fix your arm here. Stay up tall. I just want to readjust his arm and hand so I keep better inhibition in the hand and weight bearing as I do this. I'll just move you a little bit.
And she's moving him straight laterally to the left side, using primarily her right hand, facilitating the muscles on the right side of his trunk with the ends of her fingers.
He's fairly stiff that way. You can tell I'm working hard, right?
It's mainly a passive stretch.
Now you can move with me just a little. Just go
Now
with
she's
the flow.
superimposing active
That's it.
movement of his right trunk to help shift him to the left.
So as with a lot of times with the lower trunk on the involved side being a little lower toned, once the back loosens up, he tends to sag to that side just a little and actually slump more onto the right hip. And then he tends to hold dynamically with the left side in an equilibrium reaction, which makes him not want to let go of the shortening on the left side of his trunk. That's what made it hard to shift him toward the left. He didn't want to elongate, so I got resistance to that movement on the left. Now he's doing that a lot more readily. Now just stay tall right there. Okay, now you're going to shift a little bit toward your right, only stay tall. That's it. And then back to the center. I want to work a little bit on weight shift toward the right. Toward the right now, keeping him more dynamic with elongation. Up straight.
He maintains his anterior tilt.
And then come back to the center. Stay tall though. Good. To the right. Come back to the center. Good. And then to the left. And stay
And
tall.
then you can see he's much more dynamic in the low trunk on the right side when he shifts to the left.
To the left again. Going to each side of the midline, back to it, stay tall. Bring your right shoulder forward toward me just a little. That's it, good. Okay, now I want to see what it's like when I just bend you forward. Your hands will basically stay where they are. You just keep your arms more relaxed, okay? All I want you to do is keep your back straight as you bend straight, your top straight toward me. That's it. I need to see if he can stay on the midline as he bends forward. That's it.
He needs to stay on the midline and also keep his back erect, which makes his legs more dynamic.
To the left a little. Easy. Forward. That's it. Now stop right there. Straighten your back just a little. Not just your head. Bring your chin down a little. That's it. And then sit back where you started from.
Many patients will tend to exaggerate neck extension when they need back extension. She doesn't want exaggerated neck extension, but she does need to have the back fully extended.
Just bend toward me. Okay. Now just stay right there for a second. I just want you to push your feet into the floor, but don't stand up. Just push both feet. Now when he pushes, now relax and do that again. The left leg comes in, but the right one doesn't. Okay, so I'm going to help you with that.
She's going to do a little more preparation to help him learn to push better with his right leg before she attempts to bring him to standing.
Now just come toward me, bend. Relax your left arm just a little. That's it. Just keep coming. Now just stop right there, okay? Now push both feet into the floor. Push. Straight down.
And you can see she's giving a downward pressure into his heel.
And then relax for a second. Now just slump for a minute. You okay? Mm-hmm. Just let me know if you get too warm. Mm-hmm. Tall.
Now, she works to have him have a nice tall back. She's not exaggerating the anterior tilt.
I'm going to bring your feet back.
Because she wants the abdominals to continue to work as well.
This one back a little. Not quite that far. Just right about there, okay?
Before he can come to standing, his feet need to be in a better position so that he can come over them more easily.
Right leg back himself. Just stay left. I still don't want you to overdo this with the left arm, okay? Slump for a second. And stay to the left a little more with your hips. That's it. Good. Stay to the left a little more. That's it. Just with your low trunk. That's right. Don't work too hard here. That's it. Stay tall. Okay, now just bend toward me. Okay? Now push up just a little with your legs. Now into the floor. Done. You're going to lift off the surface like you're going to stand. That's right. And then you're going to go down. That's right. That's what I want, exactly. Okay? That lets me know what you're going to do with your legs. You did fine. Part of that's just knowing what I want, I know. So we'll take the time to do that.
Okay, Jan, a lot clearly going on in that tape. A couple of highlights?
I think the main things are to realize that when you mobilize and get more mobility in the trunk, that it's very important to overlap it with getting him more dynamic and get him to actually immediately use the mobility that you gain. The other thing that I think is really important is what I did with the arm. The weight bearing on the arm, first of all, was a little different position than Bo had talked about earlier. He's a little higher level. If you can keep the shoulder forward and control the tone in the arm, having the arms to the side is a much more functional position for doing things like scooting or coming to standing and for the arm swing position and gait. But I think it's really important for people to have noticed that the arm really stayed controlled and he really got much better function in his arm, even when he started pushing with his legs toward the end.
Now, he was clearly a very cooperative patient and also perhaps both intense and tense. Was that a concern as you were working with Don?
The whole time I worked with him, I had to tone him down emotionally as well as physically. He was very overzealous about doing what I wanted him to do.
And having a video camera.
Really an achiever.
Yeah.
And he was also frustrated about, I think, the aphasia as well.
Sure.
So I had to really grade the activities. I think it's really important to notice that through that whole sequence, the preparation for coming to standing and gait, I really graded everything very carefully.
Now, what do you want us to look for in the next tape, which will be our second and final look at you working with Don?
Well, it's a sequence into standing and into some gait activities. I think the tools are probably the things that are going to be a little bit different about that particular segment. I used the overbed table, which most people are familiar with, and then progressed to the grocery cart, which is a tool that we use a lot. It's a stable tool. It's something that's familiar to the patient, and it really promotes more symmetry and midline orientation, and just better weight bearing on the involved side. And then the clipboard I chose to use for his foot, so he would not feel like he had to lift the leg so much and inhibit the elevation of the pelvis.
All right, then. Let's now observe Jen with Don starting at the overbed table.
Now come a little bit towards your left hip. That's it. I'm just going to get you on the midline again before we start off, all right? I'm going to do a couple of bends forward, just with your top. Wait, don't get in a hurry. Just nice and easy. Keep your right foot on the left foot on the floor. That's it. And then go back. Okay. Stay to the...
She's allowing him to use his left arm to help as he comes forward and is going to push up to standing.
That's it. And then go back. And as long as he doesn't go into a strong associated reaction on his right arm, I'm just going to let him keep it to the side because I really need both hands on his trunk at this point to help him stay on the midline. Now just bend toward me. Good. And then back. Okay. Toward me. Just come off the surface. You're going to stand up. Just stand. Stay to the right a little bit. Let your hips come forward.
As he comes
Take
up,
your time.
comes over his feet,
Good.
brings his hips forward and
Just trying to help
straightens
him
his
not bring
knees,
that right side back.
and keeping him on the midline enabled his
Bring your hips
arm to
forward.
stay more relaxed.
No, this part of your body right here. That's it. Easy. Don't bring your shoulders too far back.
The overbed table has been introduced to allow him to weight bear on his right arm, now that he's up and standing.
And just stay up tall. Relax your left shoulder a little bit. That's it. Bring your hips toward me. That's good. Relax. That's it. Without relaxing your legs. I just want to get to the point where I get your hand on the surface. And I get a little higher. All I'm doing is just keeping you aligned where you should be in standing. Okay? It's going to feel different from what you usually feel. Bring your, that's it.
It's very different for him to be standing with weight on both legs. He tends to keep it all on the left without any input. So she's maintaining midline, helping him learn where he needs to be to have equal weight bearing. And now she will place his hand on the overbed table.
Toward me just a little bit. That's it. Relax this. That's it. Bring your shoulders forward just a little.
Again, by continuing to get him to make the corrections, he's learning where he needs to be and what he needs to do with his own body to be in the correct alignment.
Right hip. That's it. And I have to be really careful when I put his hand up here. Bring your right shoulder forward just a little bit, Dawn. That's it.
It would be very easy to retract his right shoulder as she placed the arm on the table.
Good.
So she's being very careful about that.
Straighten up your right leg just a little bit. When you do, keep your hips forward, but don't bring your shoulders too far back. Now turn your body a little bit. That's good. That's great. Just remember, this part goes back more than anything else, right there. Mm-hmm. I'm just going to work his arm a little while he stabilizes. Relax your left arm.
His usual standing posture is very different from the posture he's in presently. So he needs time to get used to being on the midline with the shoulders aligned over the hips and everything aligned over his feet more equally.
Stay tall. Tall in both legs.
It's very important to keep him in this posture for a long enough time for him to get used to it.
Okay, now.
And then you can use it with weight shift and taking a step with the left leg.
Your right side.
And you'll be more willing to stay better aligned.
That's good. And take it easy. Stay tall. Straighten your legs up. That's it. Now, I just want you to bend both knees just a little. That's good. That's enough. Wait. Stay right there. Let me turn you a little bit. That's it. Now, I want you to stand up straight. Bring your pelvis forward as you do that. That's it.
Once the patient has achieved a good alignment in the trunk, it's important to be able to maintain this as you do something with the limbs. And one of the easiest things to do is to have them bend both knees together.
That's enough.
And then come back up.
Good. And then come up straight.
All the time maintaining good trunk alignment.
I've got both legs on his because I want him to bend equally, so I don't want the left one to bend more than the right one or vice versa. Okay? Just bend a little. Stay right there. And then come up straight. Easy. Good.
This way he learns to bend.
You're doing great.
His legs bilaterally together, which is very difficult for most people.
Easy. Stay right there.
And then straighten them
Bend
together.
your left knee just a little more. That's it. A little more.
Many patients will bend one and then the other,
tall.
and then straighten one and then the other.
Easy. Okay. Now, I'm going to shift a little bit toward your right. So more weight's on your right leg. That's right. Easy. Not your shoulders. Just your whole body. Let me do it with you a little bit. Over and then back. Okay. You tend to move one part without moving the rest. That's it. The whole thing stays stacked up.
And that's very common.
Easy.
And they need to learn to move the
Bring your
whole
right
body
shoulder forward just a little.
over one
Easy.
leg
Not your hips
and then back
That's
to
good.
midline.
Okay.
Again, is facilitating his trunk so that he stays dynamic as well as maintaining his alignment,
Okay, now.
with very light cues to help him make the adjustments.
That's it. Now I want you to move your heel on this foot just out to the side, just a little. Just like that. It's all right. And then put it down. Don't forget to do that, okay?
This activity is a little more difficult than
Now we'll
what
do
she's
that
done
again.
thus
Okay,
far,
wait. You're gonna shift
because
first.
she's asking him to take a little more weight on
your
his
stomach.
right leg while he moves his heel out.
Okay, you put more weight on. That's good. Now move your heel out just a little bit on the left. That's it. Easy. Okay. Now just stand up tall
This
right
is
there.
a way of grading
I'll get
the
you.
amount of weight
Just wait a
bearing that
second.
is
Bring your
taken on
shoulders
the
forward.
involved side.
Stand tall. Okay, now bring your right hip forward just a little. Okay, now, this time I want you to shift a little bit to your right. Stay tall. Keep your hip, that's it, and bring your heel back in where it started from. That's right, good. That was a lot better.
And that time, the alignment was maintained better as he moved his foot.
Good. And in.
Oftentimes, after they've done an activity once, they have a feel for what is required, and they're able to accomplish it more easily the next time.
Okay, wait a minute, wait. Don't let, bring your right side, your right hip forward just a little. That's it, easy. Just want to keep your arm, okay? Okay, now you're just going to bend and sit down. Bend both knees. No, come back up, okay? Bend both knees. That's right. And then you're just going to go down. That's it. Good. Now we're going to shift a little bit that way, only you're going to stay tall. That's it. And you're going to bring this hip forward. That's it. Then you're going to go back onto both hips. Easy. Then you're going to go the other way, only stay tall, and move this hip forward. I think it's really important to see how much better he does that, and the arm is a lot further back in weight bearing than it was before and a lot more inhibited. Relax your arms. Good. Okay, now we'll bring the grocery cart in. We chose to use the grocery cart because I feel like it'll make it a little easier for him to eliminate the abnormal patterns that he tends to have in swing on the involved side. Just stay tall. That's it. Stay up straight. This hand's going first, the other one can stay there for now. It's important to put the involved hand up first so you don't play into the retraction on that side. Then the other hand can go on the rail, only as far to the edge as possible. That's right. Then just let your elbow drop in. That's good. Bring your left knee in just a little. That's it. Okay. Move your left foot back slightly, not a lot. That's good. Okay, now straighten your back up. Your arms are going to just stay relaxed, okay? And we're going to bend a couple of times with your back straight, okay? You're not going to stand, you're just going to bend. Relax your left shoulder. Only look at straight ahead. Arch your back a little. That's it. Good. And then come back. Slow. That's it. Arch a little. Good. Easy. Don't push. It'll just move. That's it. Relax right there. Stay. Relax your left shoulder. That's it. And sit back. Easy. Okay. Just relax. Hang loose. Stay tall. Good. Just bend forward and relax your left arm and stand up. Now we're just going to shift your whole body. That's it. He gets an automatic release in the left leg when he shifts to the right, which is very nice. Stand tall, Don. Use your right leg. That's it. Good. Good. Stand up straight. Tall. Straighten your legs up. That's it. Don't let it bend. That's it. Okay. Now make a little step. Stand tall. Use your tummy. Okay, a little step forward. Good. Only let your toe turn out. That's right. Now just stay tall right there. Just stay there. Don't move. Stay up straight. Let your knee bend a little bit on the left. That's right. Good. That's right. Now, you're going to move forward toward the cart and just, wait a minute. Don't use your shoulders that way. Just stay there. You're just going to slide the foot forward on the right side. Just going to slide. That's good. And stay on both legs right there. And I'm making him slide step 2 at first to make it a little easier sequence. Okay, stay tall there, both legs. Good. And then we'll work on going through. Okay, now stay tall. You can do another little step. Not big, that's good. Toe out a little. Good, and stay there. Well, don't move yet, don't move. Okay. Now, stay tall. Wait a minute. Okay, easy. You're just going to slide the foot forward. That's enough, that's enough. Now just stand on both legs there. Stand on both legs. Straighten them up. That's it. Easy. Wait a minute. Okay, now just relax your left arm. Take a small step. Good. Toe out. That's it. And just stay up tall. Slide the clipboard forward a little. That's good. That's enough. Don't go any further than that. Now stand on both legs right there. Wait a minute. Let your knee bend. That's it. Stay tall. Easy. Now step, just a small step. Bring your hips forward. That's good. Toe out a little. No, not forward more. Stay tall on both legs. No. Wait a minute, wait a minute. Stay right where you are. Now just easy does it. Easy. That's enough. Now stand up tall right there. Sit up a little straighter. Okay. Now you're just going to bend forward and stand up. Stay toward me. That's right. Good. Just stay up for a second. Just want to get your hand a little more inhibited. But relax here.
And he didn't get a lot of increased tone on his hand, which means that he had better weight bearing on the right leg.
Keep it a little closer to you. I just don't think yet.
It's important to keep the cane close to the body so the patient doesn't prop it out to the side.
I do want to inhibit his hand just a little as he starts out. Okay, relax here a little. Okay, you want to step with this leg first. Easy.
The cane is kept closer to the body. It tends to
That's it.
keep more weight onto the right.
No, wait a second. That's it. Keep your hips forward.
As you notice that his right leg is more relaxed on swing. He comes over his foot better. He still needs to get a little more weight on the right. But his weight bearing is better, which means that his swing leg is more relaxed as it comes through.
Okay, another very productive single session and a good deal of difference between Don here and in the earlier tape. What thoughts do you want to leave us with?
Primarily just what happened right at the end. I really, when he came to standing from his wheelchair, as he walked, I really did not give him any input at all except to just hold his hand a little bit. So that carryover was really all on his own. Basically, we choose to work with the cane some while we're handling them, but I just wanted to see what he would do on his own.
All right.
This concludes the clinical update presentation of Clinical Management of Lower Extremity Function with a High-Tone Ambulatory Patient, which featured Isabel Bowman and Jan Utley. For more information about Clinical Update or any of Aaron's educational programs, call or write the American Rehabilitation Educational Network